Good, good morning or good afternoon or evening, wherever you happen to be in the world. This is Medtech Unfiltered. I'm Amanda Pedersen. I'm the news editor at MD+DI. And I'm very excited that today we will have a guest speaker joining us on Medtech Unfiltered. So without further ado, while we wait for our guest to join the feed here, we'll just give him a second. Okay. It is. Okay, so we're bringing our guest in now. Hi, everyone. This is Brandon Fisher, and Brandon is the Director of Sales at PPC Flexible Packaging, and he's here today representing the Sterilization Packaging Manufacturers Council because it's actually a really cool day. It's a really special day. It's the inaugural day for the inaugural celebration of Sterile Packaging Day. You know, if you're anything like myself, when you just heard that it's Sterile Packaging Day, you might be wondering what the heck that's all about and how exactly you could go about celebrating a day such as Sterile Packaging Day. So the best person to tell us more about it is Brandon. Hi, Brandon. Thank you for joining us.
Hey, Amanda. Thanks so much for having me.
Yeah, this is great. I'm really glad that you could be here, and I'm really excited to learn more about sterile packaging and what this event is all about. Could you maybe start by telling us what inspired Sterile Packaging Day and what you hope that the industry gets out of this?
Absolutely. Thank you. So just to take a step back here, this started with the Sterilization Packaging Manufacturers Council. Companies like Amcor, Bemis, Technopak, PrintPack, of course, PPC Flexible Packaging, where I'm an employee of. And we all put aside our competitive nature because we are inherently competitors in the industry to look at the betterment for the patient because we all realize that we have a tremendous responsibility in producing flexible packaging, rigid packaging that's utilized in conjunction with sterilization to prevent bacterial infections, SSIs, and ultimately to keep everybody safe. So we felt that while it can be a dry topic and not everybody has an interest, but we figured to create a day that really embodies all the facets of it, everybody from the regulatory bodies, the med device manufacturers, the sterilization companies, healthcare professionals, really everybody who plays a role, bringing the attention to what we're kind of coining is the silent hero. We felt that was critical.
Absolutely. You know, I've been writing about the medical device industry for a long time, and I'll be honest, I often think about the engineers that are the R&D engineers that are doing the research and development on the device itself. But it seems like the sterilization, or should I say packaging engineer, is kind of brought into the fold kind of at the end of the development cycle. And I don't want to say an afterthought, but it does seem that
that's a fair way to put it.
Okay. But yet when you really think about it, they play an incredibly important role in the entire process, the entire product development cycle. So could you talk a little bit about what their role is and why sterile packaging is so important, particularly in the medical device field?
Yeah, absolutely. And when we started the conversations to talk about having a Sterile Packaging Day, I mean, a lot of it was talking about how do we engage a broader audience rather than the people who specifically follow the companies that manufacture sterilization packaging, And I figured, you know, one way to showcase the way things have changed and the impact of it, you know, what I like to see is some of those infographics of, let's look at sterilization over a 100-year period, and then let's benchmark it based upon how many surgical site infections and what the mortality rate was from surgery. And yes, you are right. Calling it an afterthought is definitely appropriate, although it's definitely more critical than that. And I'd say that the awareness of sterilization packaging has come more to the forefront as we continue to increase the governance by the FDA and evaluation of our med device products. Simultaneously, we have to step up as manufacturers of the packaging to ensure the safe transit of the products going from manufacturer of the med device all the way into the hospitals, to the nurses, to the doctors that are going to utilize that medical device and open up that package, make sure there's a safe transition of sterility to the sterile nurse. So it's something that I think that is becoming more and more, it's coming to the forefront of people's minds. And we've partnered up with a lot of great people that are huge contributors here, everybody from med device manufacturers to companies like Steris and Sterigenics, and who could forget DuPont and their contributions with Tyvek. Yeah, I don't think you can say sterilization packaging without mentioning them. But ultimately, you know, we ourselves at the SPMC, beyond just promoting what we're doing and what we do to celebrate how we contribute to the world, we tend to be on the front line in developing white papers and contributing to the ASTM to discerningly create test methodologies that will ultimately trickle down into patient safety. And we implement these into ASTM tests that are then validated and published. So we are trying to do our best to work on the front end of things, and we've got an incredible technical committee that I'd love to say I'm a part of, but those minds are a bit larger than mine. So I'm on the marketing committee here, but it's a great team of people, and I'm definitely honored to be a part of celebrating the day.
Okay, great. So speaking of which, how exactly, what are some ideas for ways that people in the medical device community today who see that it's Sterile Packaging Day and they want to take part in some small way, what are some ways that they can help raise awareness or celebrate or just recognize one of their packaging sterile packaging partners or colleagues?
Yeah, we came up with 5 solid ways that we pushed out to everybody, and some of on our website and on our LinkedIn feed that some people may have seen. I mean, recognizing a colleague, Andrea Fischlowitz, her maiden name. She's a good friend of ours. She's a nurse practitioner, and you know, God bless her. I've got 2 young kids, a 4-year-old and a 13-month-old. And you know, you better believe that, you know, when my child has like a 99.6 degree like temperature, we're calling her like the crazy parents that we are. And it's people like her that, you know, help support everybody in the community. And certainly in times like now during COVID and the pandemic, they're putting themselves on the front line. So recognizing a colleague, always important. Just raising industry awareness and spreading the word to the network that you know about the value of sterile packaging and how it's utilized. And, you know, you could see that on an everyday basis of, you know, you fall down and your kid scrapes your knee, you grab a Band-Aid, you know, you're utilizing products that are even with it. Perfect. There we go. That's great.
Here. I brought visual aids.
Perfect. You got some medical grade paper there, and you know, these are products we all use, and thank goodness, you know, we're preventing the transmission of those bacteria to create infections. Another way is just supporting your frontline workers. One thing that I love to see, and I need to make good at this and hold myself accountable, but, you know, delivering lunches and a meal to those at your local hospitals, and just supporting them, and having them understand and know that the community values what they're doing. I mean, it's a tough time. I mean, I personally couldn't imagine putting myself in that position, like I said, with my 2 kids and having a family with others that have underlying health issues. So I'm incredibly appreciative of that. Organizing a blood drive or donating plasma, always a great way to give back to the community. And like you had just shown, identifying sterile packaging. And I think that's one of the ways that we can all relate to it. I've got a great little medical kit that we bought basically when we had my daughter Grace. We have medical kits all over my house now, because when you become a parent, you get a little paranoid, and the amount of products that are in it that run through ETO, gamma, VHP, or any of the other sterilization methods that are out there. I'm so happy that I have them, and we have that safety net. So those are some of the ways that we came up with. And we're certainly hoping that as the years go on, and this is our first inaugural, so it's going to be a little clunky rolling out here, but getting more people involved and figuring out other ways that we can shine a light on this. I mean, this year, of course, we're looking at mass consumption of diagnostics and pharmaceuticals. And these are all products that are really critical to understanding what kind of medical choices are we going to make. So it's an unfortunate year, but definitely an opportune one to take a second and step back and realize what we've done as a human collective to bring safety to the patient.
Absolutely, because at the end of the day, all of the healthcare workers, everyone that works in the industry, whether they're a manufacturer of medical devices, or if they're a physician or a nurse, or at the end of the day, it's about the patients. It all comes down to patient safety. So
and I think everybody probably has their own story. And Deanne Dodrill, who she's our executive chairman for the SPMC, she's shared openly, and we thank her for that, a couple challenges that she's had interpersonally with her own family. And one thing that she took solace in was knowing that there was sterility in the medical instruments being utilized. My grandfather, who, thank goodness, he's still around. He's 92. He'll be 93 here in April, and he just had heart surgery a month and a half ago. Had to have his aortic valve replaced. And if you think about something like that, even 30, 40 years ago, the elevated level of risk for a surgery like that for infection, it almost becomes a deterrent as to why even have the surgery. So I'm incredibly thankful that, all those around me have extended life longevity. My grandfather gets to see now, 5 great grandkids growing up. Great. Yeah. So it's wonderful.
Well, happy early birthday to him. That is awesome.
Thank you very much. Thank you.
Well, that's all the questions that I have about Sterile Packaging Day, but I do want to just real quickly give our viewers an opportunity, if anybody has any questions for Brandon about Sterile Packaging Day, or about the Sterilization Packaging Manufacturers Council. That really is a mouthful, isn't it?
Yeah, it is. I mean, SPMC for short. And another thing too, to put out to the audience and any future watchers of this, the Sterilization Packaging Manufacturers Council, you just Google that, it'll pop up. It's a great website. Definitely a shout out to Lourdes Pogue, who's our graphic designer, who really helped us support the rollout of these efforts. But on the website, you'll find a collective of all the published white papers that have been established that are all about, it's all about establishing and spreading good testing standards and best practices. And it's something that we spread through the industry. And it's not something that anybody is doing for a profit. it's donated time that all these companies have chosen to come together and pool their knowledge. And a lot of this, you could look at it in a competitive environment as, this is intellectual property, but everybody's come together for the greater good, which is really, really exciting to see. So I'm a newer member, but as you can probably tell, I geek out, I nerd out about this stuff because it's my life. But it's great to participate in it.
I personally have learned a lot about packaging through my colleagues, particularly our MD+DI editor, Daphne Allen. She worked on our sister publication, Packaging Digest, for a long time, a lot of years. The majority of her career, I believe, was spent talking to packaging professionals. So whenever I have a question come up about packaging, she's my go-to for that. So I really have appreciated learning more about it because, as I said, it wasn't really a primary area of focus for me initially. Well, thank you so much for joining us, Brandon. We'll be sure to share the links to the SPMC's website. We'll share that in the comment section. If viewers can check that out. And yeah, thank you for joining us. And I'm really excited to see how this event progresses, especially, as it goes on, and hopefully we'll be doing this again next year.
Absolutely. So, thank you so much for your time. I appreciate you guys supporting us and giving us a platform. So greatly appreciated. And anybody out there, feel free to reach out if there's any questions, and have a great first Sterile Packaging Day.
Yeah, same to you, Brandon. Thanks so much.
All right. Take care.
Yep.